Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Well, Deb, thanks for joining me on the Inside edition of Here for Good.
Thank you, Dennis, for inviting me.
I can't start without first acknowledging a pretty big milestone, and that you are celebrating your 50th year with Virtua.
I am, and I'm so proud of that.
How in the heck did that happen?
I know. That's what I keep telling myself. How did that happen?
I do want to thank you for all that you do for Virtua and the communities that we serve and our patients. And you are what I would consider to be a champion of humanity. So thank you so much for sharing your life with us.
Thank you, Dennis. I really have had a wonderful opportunity here at Virtua. I've grown up from a young girl to who I am today, and it is all because of Virtua.
I know that you grew up in Camden.
I did.
And you lived pretty close to Our Lady of Lourdes.
Actually, I lived on Pershing Street, which was between Dayton and Decatur, which was considered South Camden. Oh. And when I would stand on my back step, I could see the Blessed Mother. We were that close.
Really?
And it always had such a special place in my heart.
How did your career at Virtua begin?
I always knew that I wanted to be in healthcare. I wanted to be able to make a difference, to help others. Mm-hmm. And radiology really just became an interest of mine. So I applied to several different schools, and one of them was, at the time, West Jersey Health System, Camden, on Atlantic Avenue. And when I was accepted, it was a no-brainer that I wanted to attend there because that's where my roots were. That's where I grew up.
Walk me through some of your various roles at Virtua.
When I went to radiology school, I had planned, after 2 years, I'm going to work in a doctor's office. I was offered a job at our Voorhees campus.
And you jumped on it.
I did. Back in the day, it was called Eastern Division. And I started out as a radiology technologist, and I worked full-time till I had my daughter. Then I worked part-time, and then I went back full-time. And I then became the assistant director. And I really learned a whole lot about who the person that I am, and who I wanted to be. And then I had an opportunity to spend 25 years down at Berlin, which has a very special place in my heart, too.
What aspects of Virtua do you think has remained constant?
What I really love the most about Virtua is that we always care about our patients. We want to provide the best quality of care and the best patient experience, but we really, truly care about our colleagues. And that has been paramount throughout all of my years. And we're meeting our colleagues where they are, just like we're meeting our patients where they are.
I think it's really nice to know that caring culture has remained constant. What are some of the biggest changes that you've seen?
Back in the 70s and 80s, patients didn't ask their physician why they were having a test. They weren't saying, why do I need to have this done? They were just doing it because the doctor said so. Now they're informed. Now they want to know the why.
The more informed you are, the better decisions you can make. And being a part of that decision-making process for your own healthcare journey, I think is a good thing, right?
It's a wonderful thing because I just think that then you're in control and you can make those decisions along with your care team.
As Senior Vice President of Health Equity and Community-Based Programs, how are we, in your mind, addressing community needs in a way that could have a meaningful impact?
We started the Community Health Needs Assessment back in 2013. And
we're still doing that every 3 years,
correct?
Every
3 years, and we're actually in the process right now. And we're listening to our patients. We're listening to our community members. We're listening to social services and asking them what we should be prioritizing in their health care. And based on those results, we are creating programs And one of the most wonderful program that we have is our Eat Well program.
Which is near and dear to my heart, as you know.
Absolutely,
As you know.
absolutely. And it is because of your support and the support of the Board of Trustees that we have been able to move our Eat Well programs to where they are today, to be able to provide fruits and vegetables at a reduced price, and to have a mobile grocery store that goes to areas where it's very difficult for the residents and our patients to get to a bricks and mortar grocery store.
A lot of people don't realize that we have food deserts within our own communities that we serve.
We have a brand new mobile grocery store, which is just absolutely wonderful. And we are getting a second mobile grocery store, which will act as not only a mobile grocery store, but a food pharmacy. So our food pharmacy program is where a patient goes to their primary care physician. They are asked a few questions about food insecurity. If they answer yes to any of those questions and they have a diet-related illness, then they're referred to the food pharmacy, where they come in. We have a dietitian who teaches them about good nutrition. We provide them with food for 10 meals, and we follow them for like 6 to 9 months.
We're not just providing food, but we're actually making sure that healthy eating has a positive impact on their health status.
Absolutely. And that's really all part of our social determinants of health through our health equity program that we're really looking at. Because I always use this analogy with my team of Maslow's hierarchy of needs. So if you don't have the basics, food, shelter, clothing,
Nothing else matters.
nothing else matters.
Yeah. 50 years is a long time.
It is.
And it shows commitment to community, it shows commitment to this organization. But along the way, you had to do certain things to retool or to advance your own career. How has your educational journey played a part in that?
When I graduated from radiology school, it was a certificate program. And Virtua really has given me the opportunity to get not only a bachelor's degree, but also a master's degree. And I really have been able to use those tools to really take a look at strategically how we can be part of moving our programs forward and really be part of the strategic plan of Virtua.
Share with our colleagues a little bit about your family and why you light up so much when you talk about your grandkids.
My family is my heart and soul. I love them dearly, and I would do anything for them. I have 3 children that I'm very, very proud of, and I have 3 grandchildren and 1 on the way. Owen is going to be a big brother in September. So Allison, who is my 17-year-old granddaughter, Ryan, who's my 14-year-old grandson, and Owen, who just turned 2.5, are the light of my life. So for Owen, as you may know, that he was born at CHOP. He had to have a heart transplant at the age of 10 months. And there was lots of ups and downs throughout the journey, but he's thriving, and he is a beautiful, sweet 2.5-year-old who I just absolutely adore.
And that is so wonderful to hear, because we all kept him in our thoughts and our prayers, and we knew much about that journey and how that was so important to you and your family. It's great to hear for Owen. What about you? What is it you enjoy doing outside of work?
I like to read. I like to just spend time with my family. We have a little place down the shore, and we, go there on the weekends. In the summer, we take our vacations down there, and we even go there during the winter just to kind of get away and to relax. So I really do, most of all, enjoy time being with my family.
Well, Deb, I have to tell you, your dedication and your compassion has truly made a profound impact on this organization, the community that we serve, and I can't thank you enough for just spending your professional career and your life with Virtua the way you have, and we're all better off because of it. So thank you so much.
Well, thank you, Dennis, and thank you for all the opportunities that I've been given at Virtua. I really have been truly blessed to work for such a wonderful organization, and it's just been a phenomenal career and experience.
Well, I look forward to the next 50 years with
Okay.
you or so. What a great story from just one of our phenomenal leaders. And so stay tuned for yet a new episode of Here for Good, the Inside Edition.